Hello, friends. After all that we've been through the past couple of years, it's hard not to be hyper-focused on bodily symptoms. In fact, we've actually been entrained and ingrained to look for them. But what if it's ruling your life? What if even after you get a clean bill of health, it's not enough to calm your mind? What if you're constantly worrying? Every grumble, rumble, heartbeat chill, you're thinking, what if? Potentially, you might want to look into with your doctor if it's possibly health anxiety. According to Anxiety and Depression Association of America, there are two types of health anxieties: somatic symptom disorder and illness anxiety disorder. And the latter was formerly known as hypochondrosis. Now, many people with health anxiety are often actually unable to function or enjoy life because they're so obsessed with their fears and preoccupations. Every single bodily function, breathing, heartbeat, physical oddities such as skin blemishes or physical discomfort such as headaches, stomach aches, and lightheadedness. It can seem like a huge trauma to this person. They might worry about a specific organ. They are basically preoccupied with the belief that they have or are in danger of contracting a serious illness. And many will pursue doctors and tests repeatedly for reassurance, but they're reluctant to seek mental health treatment since they believe their condition is medically based. So even if they're reassured and they've been checked out and tests are deemed normal, this only calms someone with health anxiety for a fleeting minute, and then the questions begin again. What if something was missed? Did my doctor mention it could be something else? What is the percent risk that it could be something else? What if all of these questions? And it becomes a vicious cycle of running to the doctor, getting tested, running back for a second opinion. It can take up one's whole life. And I wanted to talk about this because we are living in a world where our amygdalas have been hijacked by negative news, by current events. And I suspect with the rises in anxiety and depression in our society right now and the current mental health crisis, that this particular anxiety is going to be on the forefront of an increase. In fact, I have actually seen many of my clients who've been, dare I say, traumatized by medicine and by what's out there with the current events, hooked into this fearful cycle. In order to help them, we had to first acknowledge what it is correctly and get them professional mental health support. And this was complemented with what we were doing to work on their brain health, their emotional, spiritual, and mind-body health. And all of it came together. And thankfully, I can say many of them are doing much better today and able to live their lives beyond their health anxiety fears. So let me discuss with you a little bit more about health anxiety, why it's important to get the right diagnosis, and specifically what anxiety is and what it isn't. And I think it's important to review what it isn't and to look at finding the right diagnosis, because misdiagnosis in psychiatry is more common than thought. And this can cause over-medication, under-treatment, or ineffective treatments. And this can have substantial consequences, including social and occupational impairment, substance use disorder, and suicide risk. So it's pretty intense, you guys. This topic is not light and fluffy. Let me give you a couple examples. See, OCD is pretty disabling. It is a disabling mental health condition, if not one of the most disabling mental health condition, and it's also highly misdiagnosed. In fact, one review in 2021 found that OCD sufferers often are undiagnosed for 10 or more years. In 2013, Johns Hopkins Boomerang School of Public Health reported that people who were depressed in their study or who had clinically identified depression and met the 12-month criteria depression, when they did a study, only 38.4% of adults actually met that impression 12 months later. So they felt that a lot of people were getting overdiagnosed. So that can cause a lot of issues if you're getting a medication for a mental health disorder you don't have, and the issue is actually something else. Because depression is often a comorbid, or means it occurs along other health disease risk factors. In previous videos, we talked about how heart disease is linked to depression. So a doctor would want to rule out all the underlying factors of why someone has low mood, even if the symptoms match the DSM-4 or 5, which is how psychiatrists diagnosis someone with a mental health issue. They have to meet certain criteria. Another example is people with anxiety and people with ADHD. These can often look similar. They can even come together. And this is concerning a lot of psychiatrists, especially who work with children, because people with ADHD do have fears, but they're based on real events. They could be nervous a lot because their nervous system is hyper aroused, and they're never sure that they have the abilities and intellect to show up when they're needed. So they can live with these persistent fears, and that can look a lot like anxiety. And the distinction between anxiety and this hyperarousal makes a big difference in which treatments will work. So for misdiagnosis, some things we need to look at is stigma, lack of awareness by both physicians and the patient that it's a real piece of business in their life that they need to look at. Issues with diagnosis accuracy, which I just discussed. Self-diagnosis is also a problem. Dr. Google, right? That can cause many people to maybe go to their doctor or maybe not go to their doctor and do some self-treatment, and it sets you down the wrong kind of pathway. Whereas if you go to someone that's objective and looking at everything, you might be able to find a more unbiased viewpoint. Awareness of overlapping issues, so different symptoms can cause an overlap with different manifestations, and I think this is important to be aware of. There are also masking symptoms where people will not share exactly what's going on with them with their psychiatrist, or where it appears that they're fine and they're not. They put on a good front. And this is why if you have a mental health concern and you really want help, it's imperative that you're upfront with their health professional along with your primary care doctor, so that you can accurately provide them a symptom picture and you can get the proper treatment. And you also want to make sure you're comfortable with them, because that therapeutic relationship is healing in and of itself. So that's kind of why it's really important. The consequences of a mental health disorder are just as, may I say, morbid as someone with a chronic health illness that doesn't get diagnosis till too late. You want to make sure that you really are taking care of your mental and emotional health, because as I mentioned, it can lead to other issues down the line. And I'm the mind body, I guess you would say, queen, where I really feel, and we know now that the mind and the body are connected. So mental health can lead to physical health issues, and physical health issues can lead to mental health issues. And this is why really having an integrated viewpoint of both of them is so important. Now, let me talk a little bit about more what anxiety isn't. So anxiety isn't about coping with a scary diagnosis. Health anxiety isn't the same as someone who has a legitimate health diagnosis and is coping and coming to terms with it. It's when the brain is constantly scaring the health out of someone and there's no physical evidence of a disease process. Health anxiety isn't also with someone that feels physically lousy and they can't find the answers, and they might be able to go to someone in functional or naturopathic medicine who can validate that their primary care doctor did not find a pathology, but maybe their symptoms or their systems are optimally functioning. There's an underlying functional issue or physiological issue that isn't exactly a pathology yet. So that's what health anxiety isn't. It's not coping with a scary diagnosis. It's not someone that just feels bad and is trying to find the answers. But it is someone who is constantly worried about every bodily symptom and obsessed with thinking that something is terribly wrong with them when there's no physical evidence that there is. Another thing anxiety is not is stress. It's one of the most common mistakes I hear people label is themselves as anxious when it may actually be stress. Anxiety is a mental health issue. Stress is a situational, circumstantial issue. But it is true that chronic stress can cause structural patterns in the brain that lead to anxiety or mental health issues. And people with anxiety actually have a different brain physiology. So chronic stress has been associated as a risk factor for anxiety, depression, and other psychiatric disorders. But remember, there's a distinction. People who are stressed can experience physical symptoms such as irritability, anger, fatigue, muscle pain, digestive troubles, and difficulty sleeping can look like anxiety. But anxiety is more persistent. They have excessive worries that don't go away even in the absence of a stressor. And it leads to nearly some of the similar identical symptoms I mentioned: insomnia, difficulty concentrating, fatigue, muscle tension, irritability. And I also, on the accompanying article that goes with this video, which I'll link to in the video description, I have some research on the different brain processing patterns that are characteristic to individuals diagnosed with mental health illness. So they have different neurotransmitters, neuroendocrine signaling, anatomical and neuroimaging findings on brain scans, as well as genetic variations to those without a diagnosis. Here's the big key point in that factor. The anxious brain is actually an organ dysfunction, just like a heart dysfunction, just like a bone dysfunction, just like any other organ system you have. And this is why it is so important that we don't just treat the symptoms of mental health, but that we also address brain health and look at the underlying factors that can optimize brain functioning. Okay, so we went over two things that health anxiety aren't. We talked about the importance of proper diagnosis, right? An accurate diagnosis. And part of that, remember you guys, you play into, right, is being honest with who you're working with. And doctors really making sure you're asking the right questions and making sure that we stay educated about all of these different brain patterning issues and mental health diagnoses. And remember, what health anxiety is that it's this obsession where it actually disables your life. And I want you to really be honest with yourself, that if you are struggling or someone you know is struggling, that you reach out for the appropriate care or make sure that they do, because no one needs to stay suffering. And there are tools to help overcome brain health challenges and move forward to a better life. I've seen amazing turnarounds with this integrative approach where people are working with their mental health care provider as well as with naturopathic and functional medicine and integrative doctors that are really optimizing these treatments, this therapy, with supporting the underlying brain health issues and looking at what food is nourishing for their brain, looking at hormonal connections, looking at underlying oxygenation issues, genetic issues. All of this has an impact on anxiety. So what do you think? I hope this was helpful. I'm going to continue on more with this topic in some upcoming videos. So I would love to hear your feedback and for you to provide me with any comments, with anything that you'd like to see in the future. And please make sure that you check out all the resources that I offer. There's some good free resources on things you can do for mind-body support, as well as some additional courses and offerings that I offer that you can check out in the video description. I wish you an amazing rest of your day. I thank you for taking the time to educate yourself on this important topic. I know it'll help you, and I'm sure that you can help others. So make sure you pass it along. Take good care.